Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so pleased you could be with us for this next segment featuring the wonderful Dr. Bennetts. John, thank you very much for being on the program. Dr. Bennetts is a primary care doctor, family care doctor, and you are a specialist in addiction medicine. Dr. Bennetts, thanks so very much for being here.
Thank you for asking me to be here today.
Dr. Bennetts, I want to talk a little bit about you and how you developed this interest in addiction medicine, and then I want to dive in and talk about this fascinating subject. So let's start. How is it that you got interested in addiction medicine?
I believe I was early in my practice when one of the local physicians actually was working at alcohol center called Lackey's in Carmel, and he was leaving to go to Colorado Springs and said, would you mind going over there, making rounds and seeing some of the patients and basically just doing medical care? And as I was going over once a week to see the patients, would start to do a little bit of some detoxification and take care of some of the medical needs, I slowly became more and more involved in addiction medicine. And at that time, there was a company out of Seattle that decided they were going to buy Lackey's and they were going to create this new addiction unit. And so they needed the medical director to be board certified. And so then I slowly became oriented towards addiction medicine. I went to all the conferences, and slowly as the addiction medicine became a board certified, I became board certified. And so it's became something that was very passionate just because I saw it as a need for our community.
Excellent. So, Dr. Bennetts, you are certified and recertified with the American Academy of Family Practice.
Yes.
And also you have a certification in addiction medicine.
That's correct.
So I appreciate you very much coming on the program. Dr. Bennetts, I want to make a statement which actually will become a question similar to my last guest, or I did with my last guest. When I went to medical school, it wasn't that long ago, and even when I was a surgical intern in New York, it wasn't that long ago, we considered addicts as really the hardcore heroin IV drug user. And that's what we considered to be a true addict. But since then, the field has sort of expanded, and now we consider alcohol dependency and addiction, as cigarettes can be an addiction. I hear about this, I hear this phrase called sex addiction, and I also hear about prescription drugs, prescriptions that people get from their doctors that they're becoming addicted to. So, I mean, it seems to me like the field has become so wide. So perhaps we can start off by defining what an addiction is. Is it possible to do that? Can we define addiction?
I think what you're saying is true, which is, I think we first thought of it back, I would say, medical school and training.
But it wasn't that long ago, Dr.
I know it was that long ago. But I think that the idea was that people were either morally unable to step it up, they were emotionally not able to step up, and they had to use some kind of a chemical, and that chemical was the crutch, and it was only a matter of time to force them. It's kind of like the treatment for homosexuality. It's more of, I think, our knowledge of the brain. We can image the brain now. We can understand that these are real medical problems, and these are genetic diseases, diabetes, hypertension, as well as addiction, as well as a gambler that has an addiction, a chronic liar, a person that has severe problems with alcohol that just can't stop. So they're a better person when they stop, they get sober, they seem to be a different personality when they're under the influence. And now that we're having a problem with prescription drugs, this is a huge problem because people are diverting the drugs. They're now treating their, not just dependencies, but they're treating their emotional distress. Tremendous problem that we have in the high schools now. Younger people are using these drugs to basically to settle down their nerves, stop the anxiety. Whatever it is they're medicating it with some very strong drugs, including heroin right now, which is very cheap, it's very available in our community. And so the problems insofar as nicotine, we've actually have mandated that you can't smoke at the restaurant, you can't smoke at school, you can't smoke. So we've actually taxed it, and we've actually mandated it, and so now we have less smokers in California. It's a really tremendous. But we knew that it wasn't okay to smoke, but how many people have developed lung cancer and all kinds of other problems associated with smoking? We just accepted it, we just went around, we just allowed it to happen, but people have been terribly, terribly addicted to that drug. We export it all over the world, and it's really a terrible problem because, again, it comes back to that hereditary part. We have certain nicotine receptors. Some of us are terribly addicted to smoking because we've not just seen it from our parents or our siblings, but we have some genetic predisposition. Once you start smoking, it seems to set in motion this reward system, and it's very difficult to stop it. If you look at the recidivism rate, even if people have gone through treatment, 40 to 60%. That's one of the reasons that the insurance companies won't pay for nicotine patches, won't pay for treatment for nicotine dependency because they see it as it's a lost cause.
Well, Dr. Bennett, is it true that you consider an addiction as having an actual organic basis? In other words, you could say it's a brain disorder, or I've also heard this phrase used, an addictive personality. Now, I think you're implying that some people have an actual genetic predisposition towards addiction. Is that true?
That's true. I think that the studies that have been done with twins specifically can validate that. You can see twins that have gone to two different families, maybe even to an alcoholic family or to a clean and sober family. And again, the kids still have over a 50 to 55% chance of developing chemical dependency in their lifetime, so to speak. So it may not be as a child or a young adult, but it may be in their lifetime as an adult that they actually will become an alcoholic. Or we talk about cross tolerance. They may have a dependency to benzodiazepam. So an alcoholic, maybe their sibling may have a problem with opiates like Vicodin and Norco, or maybe Valium, Xanax. And so these cross addictions are all going through the same part of the brain for the reward system. And there's no question that the idea that it's a treatable cause, just like Dr. Vieira was speaking about obesity and food habits and cultural habits. The whole thing, again, with alcohol and nicotine, it's very interesting that these will run in families, and of course these family problems also will nature and nurture these addiction problems. So when do you cross the line from having one beer or one glass of wine, and now you're having two, now you're having three? And then the person that drives and drinks, of course, what are they doing? I don't understand that, but how many people do it every day? They take a chance. We know that it's probably going to cost you $10,000 if you get pulled over for a drunk driving offense in California. So there's a tremendous disincentive to drink and drive. Why do people even think about it? Because they're not thinking. They're just in their addiction. And so I feel that people need to be given a chance to become clean and sober, to work on their individual issues, and to be able to give themselves a chance to see the world through the eyes of a clean and sober person.
Well, John, that's fascinating. It's a lot of information. I remember someone that I met when I was, again, a surgical intern in New York City, working very hard. And I was taking care of a heroin addict who had an abscess that needed to be drained, a shooter's abscess. And I was just talking to him, and I said to him, so what was it like the first time you did heroin? And he said something to me that was very telling. He said, I realized that I had had a headache all my life. And the first time I did heroin was the first time it went away. And he said, Doc, I never wanted to have a headache ever again, which was very telling to me. It's amazing that, in fact, whether he felt the pain in his head or not, but he, after one dose of heroin, wanted it forever after that, constantly. So what about the person who gets addicted to prescription medications? I mean, is that the same kind of thing, that they finally get onto some sort of medicine that gives them a feeling of euphoria or takes away their pain or helps them during the day, and so they never want to be without it? I mean, how do people get started?
I think that they get started, like you say, very innocently. It could have been an injury, they could have had an operation. It's interesting, the number of people that I see that have had addiction problems or have dependency problems to addiction drugs. It could have been their first surgery, it could have been their fourth surgery. It's really unknown as to exactly when this happens, that they finally start developing such a tolerance, but they become very dependent upon that drug to give them a source of energy and focus. And so the drug itself is driving this train. They're not driving the train. They don't feel or really respond to anything. And to be clean and sober is such a foreign feeling that they really don't want to go there. And so they use the excuse of, I don't want to go through withdrawal, so I don't want to go through withdrawal, I have to keep climbing that ladder. So all of us have the ability to become tolerant. There's an infinite tolerance to narcotics, infinite narcotic tolerance. You only have a certain amount of tolerance to Valium, you're going to overdose. There's only a certain amount of tolerance to alcohol, you will overdose as well, respiratory depression. So it's interesting that all of our mammalian brains, whether it's my cat, my dog, or my friend, or my best buddy, we all have that ability. So it's interesting that we become dependent upon it. As long as we're functioning, we have a certain amount of narcotic and we function, have our life, and we're doing fine, we seem to be fine with that. It's the patients, though, that are diverting it, that are using excessive amounts, that have lost their functional ability to actually go through their life without the drugs, and they seem to be more involved and more focused on the drug than it is about their life.
Okay, well, Dr. Bennetts, this is fascinating, and I'm sure we could I'd love to talk to you for hours, but unfortunately we can't. But what about the person who says, look, it's true that I depend upon this medicine that I get from my doctor, but it's what I need to get through the day, and it's not illegal, and I'm going to keep doing it, and that's how I get through the day. Is that so bad? Like, do we need to treat that person?
I think if the patient has an ongoing medical problem, and that's a pain problem, and they're doing well with a low dose, appropriate amount of narcotic, and they seem to not run out on the weekends, and they don't seem to have any problems with the prescription. And they seem, once again, that word function I think is very important. There's an emotional function, they work, they have a relationship with their families, maybe they have a spiritual life. The idea that most addicts, they have nothing. They just have they and their drugs. They're very alone, very alone. It's like these cowboy songs about drinking alone. They're drinking alone. They're just using alone with their drug. It's just them and the drug. And you can tell patients which have addiction problems, it's like pseudo-addiction because you're dependent upon the narcotic to keep functioning, and you will go through withdrawal and you get very sick if you don't have it. But I think there's a difference between the person that's functional, that's taking the narcotic and they're feeling fine, and it's a reasonable amount. And I think that's something that's actually, I think it's very appropriate. We have a lot of patients. There was a study that showed that there's enough Vicodin that was prescribed in 2011 that would allow every human in the United States to have a Vicodin every 4 hours for 1 month.
Amazing. Can you say that again?
There was enough Vicodin prescribed in 2011 to allow every United States citizen to have a Vicodin once every 4 hours for 1 entire month.
That is amazing. Well, Dr. Bennetts, you talked about the withdrawal. Now, is there a difference between someone who has a physical addiction or dependency as opposed to someone who has sort of a psychological or emotional dependency upon a substance? Or are they one and the same? Or do you distinguish between those two in your practice?
I think that when you understand that it's the limbic system, it's the higher brain function that you're talking about, the reward system. So I think there's a physical part and an emotional part. And then as the months and the years go on, they become very interrelated. And it's almost like you and your behavior. It's like a smoker that smokes a pack a day. I don't know how I could find the time to smoke a pack of cigarettes a day, but you'll notice they have all kinds of different triggers all during the day and the evening that triggers them to smoke. So the addict has the same thing. They've innately have developed all these triggers, all these reasons for why they use and they don't use. But the bottom line is that there are emotional triggers. So if I'm feeling bad or I'm feeling low or my boss yelled at me or my wife's yelling at me, and maybe I'll just use a little bit more Vicodin here, help me feel better. Give me a little perk me up. It'll help me focus better. And at the same time, I'm having some back pain. I got to go to sleep. I'll take a couple before I go to sleep. See what I mean? There's all kinds of reasons that you rationalize why you need it.
Dr. Bennetts, this is fascinating. It's much more complicated than I at first think about it. I want to make sure, because we only have about a minute and a half left, I want to make sure that we give out your name and number, and if you have a website. John Bennetts, you're here. Your office is in Pacific Grove or Monterey?
It's right here. It's right down the street.
Right down the street in Monterey. Dr. John Bennetts, Bennetts. And can we give out a phone number if somebody has a question about addiction or something else?
Of course. It's 373-7300 is my office number.
373-7300, Dr. John Bennetts, board certified in addiction and family practice. Before we go, Dr. Bennetts, can you give us any numbers about the number of people who may be involved or have a problem with addiction in this country?
Yes, I was interested. I looked at this weekend and I saw that there were 25 million substance abusers in the United States at this time. Only 2 million have been able to receive treatment.
So 25 million and less than 10% are in treatment.
In treatment, and of the prescription drug people that are doing diversion, they guesstimate something like 7 million. So that's 3% of the U.S. population is diverting drugs specifically for their recreational use.
I need to learn what you mean by diversion. What do you mean by that?
A person is going to either forge a prescription, they're going to buy it from their friends, they're going to use it in a way that it was not prescribed. OxyContin was a good example. People would lick off the outside and they could actually snort or smoke the oxycodone in a way that gave them a high that was unimaginable. And so the company figured this out and they created this shell the previous October, and it's this hard shell, so they can't do that anymore. And so now, rather than having, OxyContin is still available, but they have to work at it now. But you can go on the internet and learn all kinds of things, Dave, about how to take care of these drugs. It's like the pseudoephedrine. What happened to Sudafed? All of a sudden, it's back with the pharmacists. So once amphetamines and creating your own methamphetamines was a problem, you and I can't just go and buy some Sudafed off the market. We have to ask the pharmacist if I could have some Sudafed, please. It's unbelievable that we have to be careful for that word diversion.
Dr. Bennetts, I'd be delighted if you would come back again. I feel like we barely scratched the surface. 25 million people have some substance addiction in this country alone, and less than 10% get treatment. That's amazing. Dr. John Bennetts, addiction specialist and also certified in family practice, 373-7300. I so very much appreciate you coming on the program.
Thanks,
Please come on again.
Of course.
And once again, this is Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and we're coming right back after a very brief pause for a very good cause.